First of all, thank you so much for clicking the link to watch this video. Now, your question to me is probably why should you watch this video? Let me explain. Health is not just about treating an illness, it's about preventing a problem before it starts. And with the science, with the evidence, and with the research, we have definitely got a number of tests or health checkups available, which can help in early detection of a problem, which can be life saving, life changing, and better outcomes for the treatment because you are detecting the illness very early in the course of its illness. Now, within this video, there is a link for a quiz for all of you with a prize draw as well. So, do watch the video until end. And if you think that this is really useful and might be able to help someone, please do spread the message by sharing the video. So let us talk through what I'm going to talk about the health checkups today. So first thing first, what is a screening test? It is basically, in a simple term, an investigation done to find out before the signs and symptoms of disease appear, or a disease cannot be just checked on simple examination. This test could be either a blood test or an ultrasound scan test, or it could be some other similar test. Now, all these tests which are used as a screening are scientifically proven by various research. And this early detection of illness helps in either cure of the illness, or when you treat them, the outcomes are likely to be better. So let us go through them as we go and talk through all different stages of our life. Hello, good morning and greetings to everyone. My name is Pawan Sharma and I'm a pediatrician. Welcome to Child Health Matters. Now, today's topic is related to health checkup for practically everyone. Now, this is the channel which is dedicated to child health. But why did I include this topic? So, I strongly believe that the physical and mental health of child is significantly dependent on the health of the family members, and that's why we should all take care of ourselves and get the screening test done, which has been practiced in several countries. Now, even the World Health Organization recommends going through the screening test for the early diagnosis of various conditions, so that it can be treated timely manner, and then we can have a better outcomes with that. Uh, Now, each country has a different demographic with regards to the illnesses they have. So it is possible that your own country will have a different kind of recommendations or protocol or guidelines with regards to health screening. So do look into them and follow that. Having said, there are minimum basic screening tests which I strongly believe is needed for everyone. And I'm going to mention all of them, but I'm going to concentrate with more details on the pediatric age group or children's age group, as I do not have any expertise on the older age group side. So this is basically a checklist of things or screening test we are going to talk about, which starts from the baby check, newborn hearing scan, a blood test called as a Guthrie's test, ultrasound scan of the hip joint, which is also called as a hip screening test, examination of the eye. I have highlighted HPV immunization because although this is not a test, I think it's really important to prevent a future cancer. Okay, and then the other investigations which are in older age groups are the mammography done to check or early detection of the breast cancer, Pap smear is for the cancer of the cervix, and there is a fit test for a bowel cancer. Apart from that, there are screening tests for the prostate cancer as well. So we'll just go one by one. And as I already mentioned that being a pediatrician, I will concentrate or have a bit more details about the health checkup for the babies and children. And I do not have much expertise on the older age group, so I'll just give the highlights and for you to think about it, do your own research, and also get this done if you think in those if you fall within those age group. And not only this, spread the message so that everyone can take care of their own health, because most of the peoples around the world, they do not know that there are kind of screening tests available for early detections of illnesses. Okay, so let us go one by one. So let us start with the health checkup for a baby or a newborn baby, which I can describe it as as like a two-step thing. One is as soon as the baby is born, then the midwife or any other trained professional can have an immediate look at the baby. Uh, so that they can see if baby needs any kind of a help or has got any problem. Just as an example, if the baby does not cry or is not breathing, then this baby will definitely need some kind of urgent attention, and the respective medical professional will have to seek help with regards to that. The second steps comes as like a detailed baby check or a detailed newborn baby check, and that is done usually within 24 to 72 hours of the birth. And this includes looking at if the baby has any kind of any congenital or any problems which are present right from the birth, looking to detect if there could be any heart problem, any hip joint problems, and also look for how is the baby feeding, the passing of urine, opening of bowels. And this also gives an excellent opportunity to educate the parents with regards to care of a baby. Kangaroo Care. I would not be doing justice to our babies if I do not include this in this video. This is one of the most valuable practice for the health of baby and mother both. This basically involves handing over baby directly to mother to have a skin to skin contact, as you can see in the video. Now, this has many advantages, which is proven by the research as well. Uh, and that includes keeping the baby warm, improving the baby's heart rate and breathing, supports with the breastfeeding, reducing a stress in mother and baby both, improving the emotional bonding between mother and the baby. It helps in the weight gain of the baby and also in the brain development for the baby. Newborn baby hearing check is the next screening test, and this is actually practiced in a number of countries where the babies go through the hearing check at birth, also called as autoacoustic emission test. And this test is kind of trying to find out whether the baby is able to hear properly or not. The reason it is important, if the baby is not able to hear anything, they will never be able to speak. So early detection will help to provide kind of a treatment to them so that they can have a normal life for them. Now, the problem is significant. Almost 1 to 3 babies out of every 1,000 babies born can have significant hearing loss. And under the age of 5 years, there are almost 100,000 children worldwide who have significant hearing loss. So it is really important. One of the things which I always tell that if this facility is not available in your place as a part of the national program, then why not to give them the newborn hearing test as a gift? That will probably be useful for their lifetime. So next in our order of the screening test is what we call as a blood spot test, and in some of the countries it is called as Guthrie's test. This is basically taking a very small amount of blood sample from baby's heel, and that's why it is also called as a heel prick test. And then this sample is processed to check for various diseases. There are about 11 diseases which can be checked from the current practices in United Kingdom and America. And then I have given the list. You can see that there on the screen. But one test I would recommend that each and every baby must have is the TSH test, or thyroid test. This basically detects if the baby can have the underactive thyroid. The reason why this test is important, because if the underactive thyroid from the birth is not treated in timely manner, then the babies can have brain damage for rest of the life. So please, if at all you are gifting anything to any newborn baby, gift this test if it is not being done in your own country. Now, why screening tests are important? I have already mentioned in the previous slide that early detection of illness helps in either the cure of illness, or it helps in the better treatment with better outcomes. So the next one is the hip joint screening test. Now, this you can divide in two parts. One is the one is the examination by a medical professional or a trained person doing a baby check within the first 24 to 72 hours of birth, and checking the stability of the hip joint to detect this particular problem, what we call as DDH, or developmental dysplasia of hips. Now, if the baby has got this problem, which can be on one side and it can be on both the sides, then if not treated timely, then the babies will have a lifelong problem in their walking. So they may have either limping or a kind of odd gait. That's why it is really important. So the clinical examination at birth may not be itself completely effective. So in some of the babies, what we call as these babies who are at risk of developing the developmental dysplasia of hips, and your obstetrician or a pediatrician would know the conditions where this particular screening test is needed, because not all baby needs, only those who are at risk. I'll give an example. Those babies who are born by breech presentation, they should have done this test done. This is a simple ultrasound scan test, as you can see in the video, which is done around 6 weeks of age, to detect if the baby has that kind of a problem or not. And if not, if there is a problem, then they can be seen by a respective orthopedic doctor or orthopedic surgeon, and then take necessary treatment plan, so that the babies do not have a lifelong problem. During infancy and preschool age group, there are not many tests which are needed for the children. I think the most important one is making sure that they get all their immunizations are kept up to date. But important aspect is the monitoring and assessment for their growth, motor milestones, and communication skills. During infancy and preschool age, for children between 5 to 12 years of age, there are few things which are important, as you can see on the screen. So, one is vision. Obviously, if the vision is affected, it will affect their learning and their progress in their career. So, get their eyes checked. With time, more and more children, we see that they are suffering from what we call as a myopia, and they need specs for their good vision and learning. So keep an eye, get them checked. If there are any concern about hearing, get them checked by the appropriate health personnels. Okay. Growth monitoring is important with regards to their height, weight, and make sure they're following their charts, and keep an eye on the puberty. Vaccination, as we all know that there are national guidance in each country, and they follow particular um, pathway or particular guidelines. But apart from that, HPV immunization, I would like to stress that it is important for teenagers to have that, because it is likely to prevent a future cancer of cervix. You'll find I have done the another video on the HPV immunization and its importance. So do watch it and give your own opinion about it. Okay. Adolescents are age 13 to roughly about up to 24 years of age. You can say that's an adolescence, but this figure and definition may vary from place to place and what we think about it. Having said, I think I'll just go through the screen reading what I've mentioned there, that the teenage years are really all about their physical, emotional, and social transition. Key health checks include mental health screening, because we see that significant anxiety, depression, and self-harm risk happens during this particular age group. Sexual health screening and contraception counseling. Now, this vary from country to country, and then my apologies if this is outside your own thought process or your beliefs. Lifestyle assessment is important with regards to substance misuse like alcohol or any other substance. Use of screen time is gradually worsening, so it is really important that we keep an eye on that. Some vaccination will include as a part of health in this particular age group. And I would like to mention again here, those who have missed their HPV immunization during the teenage, they can seek advice from the health professional and get their HPV immunization, as it can be given up to the age of 26 and sometimes even up to 45. So here is a simple quiz for all of you, and I mean all of you. You can attempt, uh, and there is a chance to win a £10 worth of e-voucher wherever it is legally valid. Wish you all the best. Moving further, now this is not area of my expertise at all, so please do check with your respective healthcare provider and the guidelines from your national organizations. Minimum 8 to 10 checkups are recommended during pregnancy, and this visits they will be checking for weight, urine examination, and blood pressure at the least. Additional investigation or a test are done for different viruses, as you can see on the screen. Apart from that, knowing the details about mother's medications are always useful with regards to the implication on mother's own health and baby's health. Ultrasound scan during pregnancy is one of the important health checkup or screening test for pregnant mothers. Initially, there will be a dating scan. You can see the time period as mentioned on the screen. The anomaly scan is basically trying to find out if baby has got any abnormalities or any problems which are by birth, so that any necessary steps can be taken at the time of birth or even before the birth. And then there is further scan to detect other different medical conditions which you can see on the screen. Between the age of 25 to 39 years, if you see some standard recommendation and the practices followed by some of the countries, then one thing I will mention is the cervical screening or a pap smear. That is really important, which starts around 25 years of age and is done every 3 years, and that is to detect if someone is at the risk of developing the cancer of cervix. The other test or the checkups is mentioned on the screen, so I'm not going to go into details of that. Breast cancer, all of we know that it's a dreadful disease affecting women. There were about 2.5 million women in the year 2022 who suffered from this illness. Now, this can be detected early by a test called as a mammography, which is a radiological investigation. And as a routine screen, it is recommended for a woman 50 and above up to the age of 70 years, and it can be done every 3 years. It is possible each country will have their own protocol, but as far as I know, not many countries are having a routine investigation. And even where this facility is available, sometimes women uh, they do not go for this particular test. I would strongly recommend that read more about it, do your own research, and seek professional help, and then decide about this particular screening test. Screening test above the age of 40 or almost up to the age of 75 years. I have mentioned some of the investigations which could be part of the screening test, but I would like to just mention a couple of things. One, I have already given the details about the mammography for breast cancer. The second one is the bowel cancer screening, which is again recommended above the age of 50, where a stool sample test is done, and it is called as FIT test, which is FIT, which is kind of standardly recommended in some countries as a routine, but many may be failing to get this test done, and then in majority of the countries this facility is not available from the national program, so it gets undetected, and then unfortunately the detection of the colon cancer or bowel cancer is delayed, often coming to the notice very late in diagnosis, with significant impact on health and the outcomes of the treatment. So, a couple of lines with regards to diabetes, which practically all of us we are aware about. But the problem is astonishing number. You can see that about 5.5 million, as on today, are suffering from diabetes mellitus above the age of 20 years. There are 6.5 million will be by 2030, and almost nearly 8 million by 2045. So this is a tickling time bomb on our health. About 6.5 million deaths every year are linked to the diabetes or its complication. So please do take care of yourself and have regular checkup as per the advice of your health professionals with regards to diabetes. Obesity, or you can call weight above the expected weight for that particular age, is another tickling time bomb like diabetes. You can imagine, out of nearly 7 to 8 billion world population, 1 billion people are suffering from obesity. 6.5 million are adults, 3.5 millions are adolescents, and about 40 millions are children. And why we should worry about obesity? Because it is directly linked to heart disease, fatty liver disease, high blood pressure, joint problem, disability. Some of the cancers have been linked to obesity. So regular health checkup with regards to the weight and BMI calculation is really important to look after yourself. Older adults are age above 75. There is no particular definition of older adults, but I love the word older adults as compared to old age. I think because I'm also getting old. Now, the whole focus of care changes to independence, safety, and quality of life around this age, and that's why the assessment are respectively changing to those kind of screening. And as you can see on the screen, that is fragility assessment. They are at risk of falling and getting injured, so that particular assessment. Vision and hearing assessment, so risk of cataracts and other eye problems, then hearing loss as happening with the age. Now memory loss or a cognitive function is again important factor, so they need a screening for that. They may be on multiple medications, so that needs to be kept on a review on a regular basis. Bone health and osteoporosis, and they are at risk of fractures because of that. I think the main aim is to keep them mobile and help them with their memory and well-being. So let us have a quick catch up of things I have tried to talk through this particular video is The newborn baby check, hearing assessment, the blood spot test for the babies, the hip ultrasound examination in the babies who are at risk. Then, when they are in the preschool age group, around the school age time, then examination of their eyes and then assessment of their growth development. HPV immunization, I would like to reiterate its importance that a single dose of this vaccine, it is 2 or 3 doses in some countries, will prevent future cancer of cervix and some other cancers in men. Then going to the adult side, you have mammography for early detection of breast cancer, FIT test, FIT, for detection of the bowel cancer, and there is a pap smear screening test in women to detect the early evidence of the cervical cancer. Thank you so much for your valuable time to watch this long video. I hope this has been this will be useful to you. If you think that this is a good message, please do pass it on to your near and dear ones. And I'll be really waiting for your comments, both positive and negative. Thank you so much once again. Wishing you all the best of health and prosperous future.